Bismillahirrahmanirrahim. Respective Sir, Assalamu alaikum. My name is Zainab and I am from Department of BS Biotechnology. Today my presentation topic is the xylazine. First of all, I am discuss about the introduction of xylazine. Its history, it was first synthesized in 1962 by the Bayer Company. Xylazine is a drug used in veterinary medicine and sedative with analgesic and muscular relaxant properties. It is used in many animal species such as cattle, sheep, deer, horse, and dog to claim and perform the diagnostic surgical procedures, relieve pain, or act as a local anesthetic. Next one is the structure of the xylazine. Xylazine is a commonly used veterinary sedative and analgesic medication. It belongs to the class of drug known as alpha-2 adrenergic agonist. Chemically, xylazine is classified as an imidazole derivative and has the following structure formula. Here is the structure formula of the xylazine. In this structure, the carbon is connected in hydrogen as well as nitrogen. In this structure, the center carbon atom is connected to a 4 other atom and group. It forms a chain of carbon atom with hydrogen atom attached to them. One end of the carbon chain is bonded to the nitrogen atom, which is also attached to the hydrogen atom. This nitrogen atom is a part of imidazole ring system. The xylazine structure is very complex. To modify this structure, other alternating form of the xylazine are formed. Next one is the mechanism of xylazine. Xylazine primarily acts as an alpha-2 adrenergic agonist in the body, affecting the central nervous system and peripheral tissues. The mechanism of action of xylazine are the following. Xylazine acts on alpha-2 adrenergic receptor in the brain, leading to the inhibition of noradrenaline releases. This results in central nervous system depression, producing sedative and calming effect. Xylazine can cause a significant decrease in sympathetic outflow, leading to decreased neuronal activity and a general decrease in central nervous system function. Xylazine induces muscle relaxation by decreasing the release of acetylcholine and neuromuscular ejection, leading to decreased muscle tone and relaxation. Next, activation of xylazine in human body. Activation of alpha-2 adrenergic receptor in spinal cord inhibit the release of pain neurotransmitter such as substance P. This mechanism contributes to the analgesic effect of the xylazine, provide pain relief. Xylazine can cause peripheral vasoconstriction by activating the alpha-2 adrenergic receptor in blood vessels. This results in increasing the vascular resistance and blood pressure. Additionally, xylazine can reduce the heart rate and cardiac outflow by affecting the sympathetic nervous system. Xylazine may also influence the respiratory function, gastrointestinal motility, and thermoregulation. Although the specific mechanism of xylazine in body are not fully understood. Next one is the toxicity of the xylazine. Reported concentration of xylazine in human vary. In non-fatal cases, reported concentration were from 30 to 4,600 nanogram milliliter, with documented toxic effect including bladder vision, disorientation, dizziness, staggering, comas, bradycardia, respiratory depression, hypertension, meiosis, and hyperglycemia. Fatality cases reported have documented concentration ranges from trace amount up to 16,000 nanogram milliliter in both and contributory facts at sole uses. Unfortunately, therapeutic, toxic, and lethal concentration in human cannot be established because of the overlap of fatal and non-fatal concentration reported. Higher concentration exposure require medical interventions to treat various symptoms. Next one, the solubility of xylazine in other solvents. Xylazine is a water-soluble compound, meaning it readily dissolves in water. However, it may have limited solubility in other solvents. Here is a general overview of xylazine solubility in various solvents. Xylazine is freely soluble in water. It readily dissolves in an aqueous solution. Xylazine has limited solubility in most organic solvents. It is springly soluble in non-polar solvents such as ethyl acetate, toluene, and chloroform. However, it is soluble in generally higher in polar organic solvents such as ethanol and methanol. Next one is the effect of xylazine on nervous system. First one is the sedation. Xylazine produces sedative effect by acting on alpha-2 adrenergic receptor in the brain. It depresses the central nervous system, leading to a calming effect and decreasing the activity in brain. Next one is the xylosis. Xylazine has anxiolytic properties, meaning it can reduce the anxiety and induce a state of relaxation. By bonding to alpha-2 adrenergic receptor, it modulates the release of certain neurotransmitter in the brain, resulting in decreasing the anxiety and the sense of calm. Third one is the hypnosis. Xylazine can induce a state of hypnosis characterized by a deep sleeping-like state. This effect is particularly relevant in veterinary medicine, where xylazine is often used for sedative and anesthesia in animals. Fourth one is the analgesia. Xylazine has analgesic property, meaning it can provide pain relief by acting alpha-2 adrenergic receptors in the spinal cord. It inhibits the release of pain neurotransmitters such as substance P, resulting in diminished pain perceptions. Next one is the clinical uses of xylazine. Xylazine has several clinical uses, primarily in veterinary medicine. First one is the sedation and anesthesia. Xylazine is commonly used as a sedative and per-anesthetic agent in veterinary medicine. It produces sedative and anxiolytic, allowing for easier handling of animals during procedure. It is often used in combination with other anesthetic agents to induce and maintain the anesthesia. Xylazine is used to relieve the pain and muscle relaxation, which is also help in dealing procedures for animals. Next one is the veterinary surgery. Xylazine is utilized in veterinary surgery as a adjunct to anesthesia. It helps to maintain a stable anesthetic state, reduce the required dose of other anesthetic, and provide muscle relaxation during surgical procedures. Next one is the diagnostic procedure. Xylazine can be used to facilitate diagnostic procedure in veterinary medicines. It helps in restraining and calming animals, making it easier to perform examinations, radiography, ultrasonography, and other diagnostic tests. Next one is the dosage of xylazine. The dosage of xylazine can vary depend on several factors, including the species being treated, the desired effect, sedation, anesthesia, analgesia, the route of administration, and individual patient characteristics. However, there are some general dosage guidelines for xylazine in veterinary medicines. Xylazine dosage for sedation. Dogs. Typically, the dosage range from 0.5 to 2.2 mg kg administered intramuscularly or intravenously. Cat. The recommended dosage is approximately 0.5 to 1 mg kg given 1 mr IV. In horse, xylazine is commonly used for sedation in horse, and the dosage is generally 0.5 to 1 mg kg administered IV or IM. Next one is the physical properties of xylazine. First one is the molecular formula. The molecular formula of the xylazine is very unique and very complex. C12H16 N2 and S. Next one is the molecular weight. The molecular weight of xylazine is 220.34 gram mole. Third one is the appearance of xylazine. Xylazine appearance is typically a white to white crystalline powder or solid. Fourth one is the melting point. The melting point of the xylazine range from 114 degrees Celsius to 116 degrees Celsius. Last one is the boiling point of xylazine. Xylazine decomposes before reducing its boiling point. Here is some chemical properties of xylazine. Solubility of xylazine. Xylazine is freely soluble in water and soluble in polar organic solvents such as ethanol and methanol. Second one is the pK. The pK of xylazine is approximately 8.89, indicating that is a weak base. Third one is the solubility of the xylazine. So, stability of the xylazine is relatively stable. Xylazine is relatively stable under normal condition, but it may degrade when exposed to the light and the air. Fourth one is the pH dependence of the xylazine. Xylazine is stable over a wide pH range with a significant pH dependence observed for its properties. Last one is the chemical reactivity of the xylazine. Xylazine is sedative to oxidation and may react with strong oxidation agent. Xylazine reacting property is very great. It reacts with other hydrogen and nitrogen to form a complex structures. Therefore, the toxicity of xylazine in human body is increases. Next one is the regulation of the xylazine. The regulation of the xylazine varies between countries and jurisdictions. In many countries, xylazine is classified as a controlled substance or a prescription-only medication due to its potential for misuse and abuse. Regulation authorities such as Food and Drug Administration in the United States or the European Medication Agency in the European Union oversee the approval and the regulation of xylazine contained products. Last one topic of presentation is the future detection of the xylazine. The future detection of the xylazine may involve the advancement in analytic techniques and technology aiming to enhance the sensitivity, specificity and efficiency. Some potential development in the future detection of xylazine may induce advanced mass spectrometry technique. Mass spectrometry is a powerful tool for drug detection and identification owing to advancement in MS. Next one and the last one topic is the future detection of the xylazine. The future detection of the xylazine may involve advancement in analytical techniques and technology, aiming to enhance the sensitivity, specificity and efficiency. Some potential development in the future detection of the xylazine may induce. First one is the advanced mass spectrometry technique. Mass spectrometry is a powerful tool for drug detection and identification. Owing to advancement in MS technology such as higher resolution mass spectrometry and random mass spectrometry can improve the sensitivity and selectivity of xylazine detection. Next one is the targeted metabolomic. Metabolimics is the comprehensive analysis of metabolites in biological systems. Applying targeted metabolomics approaches can aid in the identification and quantification of xylazine and its metabolites in biological samples, potentially offering more accurate detection. Next one is the biosensor and the point care of xylazine. The development of biosensor and point care testing devices may enable rapidly and on-site detection of xylazine. These portable devices can provide real-time results, make them valuable in forensic and veterinary settings. These methods are used for the future detection and identification of xylazine. For this process, the xylazine dosage is decreased in our society. We will improve the decrease of the uses of xylazine in our society. Thank you so much.